Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I'm speaking with Joelleann Forbes, mental health therapist, and Renee Bradley, nurse practitioner at Women's Health in Women's Hands Community Health Centre in Toronto, Ontario. Women's Health in Women's Hands Community Health Centre provides a wide range of health and social services geared towards the diverse needs of racialized women, trans, and non-binary clients from the African, Black, Caribbean, Latin American, and South Asian communities in Toronto. How are the two of you doing today?
I feel pretty good. Excited.
So happy to be here. Thank you for having us.
No, of course. It's a pleasure. It's all mine. First off, I will start. We did recently do an episode with Women's Health in Women's Hands. And if anyone watching or listening hasn't checked that out, feel free to go back. I think it's just an episode or two back from this one where we spoke to your colleagues about the services that Women's Health in Women's Hands provides. But just for anyone who hasn't listened to that episode yet, if either of you could give a quick overview of what your community health center does, the main aspects of your organizations, and the community that you serve.
Yeah, so Women's Health in Women's Hands is located in downtown Toronto. We are a community health center that prioritizes racialized women, so Black, African, Caribbean, Latin American, Southeast Asian is our priority populations. We also serve trans, non-binary folks. We really try to have a very holistic and safe clinic and community health center. We have a variety of programs. We have mental health programming. We have dietitian and nutrition programming. We also have a food bank. We really practice in a trauma-informed and through an anti-oppressive lens, which is really essential for the communities that we serve. And we also have like various community and research projects that are always on the go.
Amazing. So part of the reason why we're having this episode and doing a two-part episode is I had the pleasure of listening to the two of you speak at a concurrent session at the Action Now conference held at the beginning of the summer by Alliance for Healthier Communities, Ontario Provincial Association for Community Health Centres. I was wondering if the two of you could tell me more and tell our listeners a bit about what I got to hear and what you were speaking on that day.
Absolutely. So on that day, Renee and we co-facilitated a skills building workshop called Honoring Pregnancy Loss in Racialized Women, the Experience of Disenfranchised Grief. And we were so happy that we were able to do a skills building workshop because we were able to create like an interactive setting and really involve participants in a way where there was a lot of lessons learned, but also people were already starting to brainstorm ways that they could apply this program in their own spaces. So a little bit more about this workshop that we co-facilitated. We spoke about running a 6-week virtual program for women from the African, Caribbean, Black, Latin American, and South Asian communities. The purpose of this workshop, the skills building group, was to build a safe and trauma-aware space, to have a non-judgmental conversation about how to provide the support to people who are navigating pregnancy loss grief, process the impact of loss of identity, and provide coping strategies, support service provider, peer support workers, colleagues on just how to provide coping strategies to support folks who are going through pregnancy loss. The topics that we shared in the skills building workshop was an overview of the body and self, right? The importance that if you're running a program like this in your own space, it's important to have conversations on how pregnancy loss impact the body. How does it change the body? Navigating the future. We cannot deny that many folks, right, are already thinking or feeling anxious about feeling, oh my gosh, I should think about the next pregnancy. People are putting pressure on me, right? Questioning their own bodies, right? And the expectation of their bodies. So it's so important for us to have this conversation around language and also navigating the future. And we also talked about challenges with navigating the system. Because at the end of the day, when working with racialized communities, we have to talk about how the system in and of itself, whether it's acute care, community care, really impacts how we feel or how clients feel when going through different barriers, right? If a client's grieving, the grieving process, navigating systems can just compound that experience of grief and loss. So during this skills building workshop, we also discussed lessons learned because we learned ourselves because this is our first time implementing such an amazing workshop at our center. And some of the lessons learned that we took away was that collaboration is so instrumental when working on proper referrals for clients who are navigating pregnancy loss. And another lesson learned was that many people want their stories to be witnessed by others. There's so much taboo and stigma around pregnancy loss, and we can talk about this later, that makes us feel that, pregnancy loss is something that people shouldn't talk about or just move past, right? So the skills building workshop really provided opportunities for us to share lessons learned, how we would do stuff differently, and how they can run this workshop in their own spaces. And to cap it off, we did a re-envisioning exercise. We got people off the chairs and people were writing their own notes and how they envision barriers, because we can't deny that, right? When working in different spaces, there are barriers to running groups. So we had people talk about what are the barriers, what are some things they could take away from our own experiences running this workshop, and ideas for the future, right? What are some things that they're taking away that they could support their own communities when they return back, right? So this is the overview of our skills building workshop. And it was a great experience for both of us, actually, because we also were able to network and have honest conversations. And people come up to us telling us how much this workshop was meaningful and how much not only meaningful in a way that we had open conversations about pregnancy loss and the need for support as well, right? So yeah, that's our amazing experience at this conference.
No, absolutely. I was in the room. Everything you said rang true. And for me, and the whole reason I pitched this podcast episode was because a lot about breaking down the stigma, but also the education that comes with it, whether it's people who are experiencing pregnancy loss and because of their culture or some of their beliefs, they have all of these other added pressures, or they're being silenced, but also how difficult it can be for the nurse practitioners, community health center staff that are speaking with these clients as well. And so it was so nuanced and there were so many layers that as just a Black woman, I had not thought about, and especially as a Black woman who's only ever had white doctors. And so for me, there were so many layers to why I felt like the conversation that you had at the conference was important, and why I felt it was important to continue the conversation here, because a big takeaway for me was the education piece, is the takeaway for everybody at the conference. And my takeaway was we have to use our platform to spread more awareness about the amazing work that you've done, so that either other community health centers can try to adopt something similar, or it sparks more conversation, or hopefully people reach out to you to get more ideas as well, or it fosters collaboration, because it's something I think it sounds like it's one of the first of its kind. And it sounds like something extremely needed for many, many women across our whole country and many CHCs. So my selfish little goal by doing this podcast, but I absolutely, I completely enjoyed it. Super engaging. And it was a lot of fun, despite sort of the heaviness of the topic. You guys kept it very light and engaging. So as you mentioned, during the 6-week virtual program that you held, I believe from what I recall that there was a counseling or group therapy component to it. And you did already express some of the takeaways and lessons learned. I was hoping that you could share some of the experience of offering the program and a bigger overview of the outcomes that you observed.
Yeah, so really this group kind of came about because Joelle and I were noticing some trends in the clients that we see. So I handle a lot of the prenatal intakes at the center, and I was finding when clients had a miscarriage, I'm calling them, I'm telling them, this news. It's obviously not what they expected to hear. And then outside of like the immediate and acute kind of medical management, there wasn't really like a set referral pathway, like a clear referral pathway of what to do next with these clients. And a lot of people expressed, that it is so challenging to deal with this. It is hard to move on. They do experience a lot of deep sadness and grief. And it's not necessarily that their family and friends understand. A lot of people feel like, well, people just think I should move on. I'm young. Like, of course I can have another baby. And they didn't really have that space. So really, with this group, we really found that the community needed a safe space to talk about pregnancy loss, whether that loss happened a year ago or 18 years ago. It was so important to create a space for folks to get that support from people who have been through a similar experience, to get that support from multidisciplinary team members like Joelle, the social worker, myself as a nurse practitioner. And it really gave the opportunity for folks to really kind of see their whole self through this process in the context of pregnancy loss, to get that validation, to witness each other's stories, to witness each other's strength, to talk about spirituality, the generational healing, and to really take some opportunities to bring some self-care to the experience. And I think in the group, it was really beautiful to see how people could hold each other up, and create that community. And we could see how like strength and pain were kind of coexisting in this space.
Mm-hmm. And just to add to what Renee mentioned, is that in this group, right, I felt this, right? Renee, I feel like you felt this too, is that this type of loss felt less stigmatized, right? Like people were sharing, like from our very first session, right? And usually in a group therapeutic setting, like it takes a while to build that trust, right? And from the first session, people were leaning on each other. And that just says like there's not many spaces, very limited spaces where people felt like they could share their experiences of this type of loss and felt supported by someone else, right? Rather than feeling judged or feeling that there's going to be more expectations placed on them, or feeling like they should be doing something else other than what they're doing, or feeling shame over still grieving this loss, right? So I think this is what we also gain from having this therapeutic approach in this group setting.
Amazing. As someone who's done group therapies, I definitely find that like that to me speaks to the need of something like this, almost like you are waiting for and begging for someone to finally offer you this safe space and hear you out, and to be able to find solace in having other people to relate to, because you're completely right. Like in my various group therapy settings, it does take, I'm very outgoing. It usually takes, session 2, session 3 to finally, break through that sort of like get that icebreaker out of there and break through some more emotional heavy stuff. And it sounds to me like, as I already expressed, like this was so extremely needed for people to be session 1 ready to sort of just like finally have that sense of like relief in sharing, which is beautiful and amazing. On a not so happy note, we'll pivot. That with the overturning of Roe v. Wade in the United States, I was able to also interview the executive director of Women's Health Clinic in Winnipeg, Kenlyn Namard. And she also highlighted in that episode that we did the stigma around abortion and abortion care. Where do some of these stigmas related to pregnancy loss come from? And what awareness building and education could be shared to help disseminate accurate information and reduce stigma from your knowledge and experience?
Yeah, this is a really good question, because there is so much stigma, I think, with the word abortion. I think when people hear this word, they think automatically that this is someone who is choosing to end their pregnancy. And they don't realize that the word abortion is used so much in medical language. So if somebody has a miscarriage, in the medical community, this is also known as a spontaneous abortion. And so, there is no choice in having a miscarriage. There's no choice in having a spontaneous abortion. And so, but this word is still there. And I think a lot of people are just kind of like triggered by hearing this word. And there's another misconception that a miscarriage equals bleeding. And I would say, in my experience, I have just as many people who experience a miscarriage who do have bleeding as who do not. And so, again, this word comes up. This is called a missed abortion, when a pregnancy stops developing, maybe at 6 weeks, maybe at 8 weeks, and there's no bleeding. And so it's not really known to anyone that the pregnancy is not going to be viable until another ultrasound is done. And then we kind of see that, things are not where they should be according to, how far along this person should be. And in these cases, like, we don't want people to be walking around, with a fetus who has stopped developing. It can be very traumatic. There is a risk of infection. And so then the treatment for this is to then have a therapeutic abortion. And so this is where you can maybe take a tablet, or maybe you have a DNC to remove the products of conception. And so I think, with this word, there is not a lot of compassion towards this experience. And so people just assume that it can only mean one thing. And in reality, it means many things and is often a treatment so that somebody can be safe and we can prevent them from getting very sick, from not being able to pass this pregnancy naturally.
Mm-hmm. No, that's super interesting. And I think I just wanted to highlight, like, this is the power of collaboration, right? Because having Renee as a nurse practitioner and myself as a therapist, right? We were able to have education around this in the setting, how we were screening participants for this group. Like, we were able to screen folks with this understanding. So the people who did participate in this group were people who were like, I don't know, am I allowed? Like, can I attend this group? Like, I had this abortion, I'm not sure, but it's because of a miscarriage. I think, again, we're able to provide this education, which opened the door to this program for many people, right? And again, like, one thing to just add to what Renee mentioned is that there's a lot of stigma around people assuming that people don't have a relationship with this pregnancy already, right? Many people assume that, oh, you could just get pregnant again, no problem, right? Or maybe it's all for the best, right? Or maybe there's a religious connotation around it. Well, it's God's plan, right? And again, that really erases and invalidates someone's experience of pregnancy loss. I just wanted to add to what Renee shared here.
Absolutely. Given that Women's Health and Women's Hands Community Health Center serves racialized women, can you share some specific insights into how pregnancy loss affects those specific groups of people, and if there are any particular nuances, challenges, or obstacles that racialized women would be facing?
No, absolutely. So this is a really great question because we actually asked this question in our program as well, because, to name it is to nurture self-awareness and to know that you're not alone, right? So sometimes many people who are in this grieving process feel like, I'm alone. There's no one else that feels like me. There's no one else that went through these experiences. And that could be so isolating. So when we were reflecting on this question, we're like, let's bring in some pieces, right? That were major themes from our group. Right. So one of them was internalized shame. So going back to what I mentioned before, people saying, like, there was shame, like, how did my body let me down? Right. Did I do something wrong? Right. And sometimes that shame is also provided externally as well. It's also important to mention here the strong Black woman identity, right? So going back to the idea of the strong Black woman identity, it's feeling that it's a societal pressure, it's external pressures, because it could be family, it could be friends, it could be the wider society, put on Black women to be strong no matter what. Like there's no space for emotional vulnerability. Like what is that, right? What's the goal of the strong Black woman identity? It's viewing Black women as this iron person who don't have emotions, who should just go through life's trials and tribulations unscathed. There's no time for emotional processing or self-validation of emotions. So when we talked about the strong Black woman identity within the context of this program, many of the participants, many of the women shared that, oh my gosh, like I felt like I wasn't allowed to feel this emotion. I felt like I wasn't allowed to grieve because I had to do X, Y, Z. I felt like I wasn't allowed to grieve 18 years later, a year later, right? So the strong Black woman identity, yes, right? There's part of this identity that helps many women survive. But on the other side, many women felt like their grief was invalidated because of the contextual pressures to just move forward no matter what, and to not be able to have the space to be emotional, vulnerable. Another piece, again, is around isolation, lack of education, as we already mentioned, emotional overwhelm, right? Sometimes there's so many emotions. It's like, this can't be like associated with the grief, right? Like where is this emotion coming from? Why am I feeling anxious? Why am I feeling depressed? And some people view this as isolated events rather than connecting it to this loss, right? And then going back to racism, classism, and ageism are also big contributor that affects these barriers or perpetuate these barriers to the grieving process, right? And we often view pregnancy loss as an acute care issue, right? I feel like many of the clients I work with, whether it's in the group or from a one-on-one space, have spoken to me. It's like, yeah, this pregnancy loss happened like 10 years ago or 12 years ago, and just move on like that, right? There's not much space. Often we have to return back and say, how was that grieving process? Were you supported during that time? And many of the situations that it's an acute care issue, then they leave the hospital, right? There's no space for grieving. So I think it's really important for us to look at pregnancy loss as a whole experience, not just one that starts and ends at the hospital.
Yeah, absolutely. I think just to add a couple other of the challenges, with our community specifically, a lot of our clients, they may not have status in Canada. They don't have an OHIP card. And so accessing healthcare can be so much more challenging for them. They don't know how to navigate the healthcare system here. They don't necessarily speak the language. And then they're in this situation where they are kind of meeting racism in their hospital experience because they've had a miscarriage. They're not able, they don't have the money to pay. They don't have a health card to show. And that adds a lot to the shame. It adds a lot to the, what if I did something differently? And so you have a lot of these challenges that are underlining this whole experience of grief and loss when it comes to pregnancy.
Absolutely. And as a racialized woman, these are things that, I think about all the time, even though it's not something I've had to experience yet. And it's something, I assume that we all carry all of these thoughts wherever we go. They apply to so many aspects of our lives. And I can't imagine having to have, that the strong Black woman mentality while having to grieve and trying to find these spaces. And it's another reason why I was so happy to hear all of this information at the concurrent session, because it hits home much differently when you look like the group of people that you are speaking about, right? I can imagine loosely what these people are going through just from my own health experiences. And so this group I'm just baffled at how important it is for things like this to be created. Do you see any particular gaps in services and supports for members of these racialized communities, specifically for female identifying or non-binary people in the region that you serve? And do you have any thoughts on how provincial and federal government policy or changes or funding could help us address those gaps?
Totally. Big, totally in all capitals here. When we're reflecting on this, one of the things is that we're like the whole area of pregnancy loss is a gap in care, right? The whole, whether it's the aftercare, whether it's the follow-up support, there's so many gaps, right? Like I don't really hear about a pregnancy loss unit, right? If you type in pregnancy loss, services are so limited, right? And if there are services, the wait list, it must be so long, right? And I think this often relates to this term that I wanted to bring in, is the idea of disenfranchised grief. So when we talk about disenfranchised grief refers to the grief that is not acknowledged by society, right? So when we think about it, there's certain losses that are more acceptable in our society. Loss of a partner, loss of a family member, right? But we talk about loss of jobs, right? Loss of a pet, loss of sense of self, loss of values, right? Loss of relationship, like a breakup, right? These types of losses don't really have the space to be further explored or validated by the external context, right? So when we talked about disenfranchised grief and really wanting to educate clients as well in our program about disenfranchised grief, is to reaffirm that their experience of this type of loss has been invalidated so many times. Their invalidation is layered, right? This invalidation of this loss is layered from the system itself, from providers, from their friends, from their families. Disenfranchised grief was ongoing. So there's so many layers that show up in their own lives. So there needs to be, with this understanding, there needs to be more funding and resources directed towards supporting individuals who have experienced pregnancy loss, what early and late term, right? For example, referrals and system navigation support should be provided to individuals who present in the acute care settings, right? So when we talk about pregnancy loss, right, again, we're not talking about something that goes like, right? One of the major protective factors for trauma is support. A person who's not supported or don't get support right after a loss or a traumatic experience can further intensify their symptoms, right? So with this knowledge, right, there's evidence behind it, right, that there needs to be better supports, whether it's the referral, whether it's system navigation, to offer it, because we need to really validate for the people in our community that your loss matters. How can we help you? You know what? We know that this is a tough time for you. Feel free, you could call us back in 2 weeks, or you could call this agency in 2 weeks and they'll be able to support you. Because when many of these people go home, there's not many supports around them already. So when we talk about the need for more funding and resources, we're also talking about shifting from the disenfranchisement of grief to the enfranchisement of grief, making this grief a valid mental health concern.
Yeah, absolutely. And I think just to add, like, the experience of pregnancy loss is so siloed in our healthcare system. It is only kind of managed in one way, and the way we manage it is that it's only going to last, for a few days to a few weeks, when in the reality, this is an experience and a journey that people go through that can take, months, and with our group, even years. And so we really need to have a more holistic approach. So, we need more specific funding that's going to expand for prenatal care programs to include this experience of loss and grief within it, and really shift pregnancy loss as an acute care issue to more of a community issue that we're providing ongoing care and support for.
Mm-hmm. And again, and to reaffirm this, right, there needs to be more investments in community health centers from both the federal and provincial governments across Canada, right, to support improved, local, because the community knows how to serve the community, right?
Yeah.
And the community knows how to provide directed support. We were able to tailor our program, right, to meet the needs of our community. We're able to use data, our case consultations, reflect on what are the needs, what are some things you could put on the shelf now, right? So to provide tailored and appropriate services and to improve local health and mental health, there needs to be multi-layered funding and investment in CHCs like ours.
Amazing. I couldn't agree more. And you actually segued perfectly into my second to last question, which is asking, based on your experiences at Women's Health and Women's Hands Community Health Center, what does that say about the ability of community health centers to adapt to emerging social and public health issues and the importance of CHCs within our health and social service systems? If you want to elaborate further, although your last line there was perfect.
Yeah. I think that, people who really want to work in with marginalized communities, work in community health centers, they have a very specific interest, a specific passion. They probably identify in some way as a marginalized group themselves. And so they really want to engage in this work. They really want to give back and support these communities. And the thing is that the way community health centers can be funded is that there's really just not enough to keep people in these roles doing emotionally intensive, mentally draining work for long periods of time. And, so what ends up happening is you end up having a lot of resignations, you have a lot of burnout, you have a lot of engagement, you have people who need to take breaks from doing this work. And in terms of growth of community health centers, it really needs to be in line with what is happening, in the here and now politically. We need to continue to be inclusive and expand the services that we're offering and making sure that, the populations are inclusive as possible. So, for example, the Women's Health and Women's Hand mandate did grow to be more intentional and specific that we do support non-binary and trans folks in the community. And I think, in terms of having specific programming in the context of reproductive health, like we need to add programming for grief and loss and really do that redefinition of care so that prenatal care doesn't include this and does not, leave people out. Because in their pregnancy journey, we have to acknowledge that grief and loss is a part of it for many, many people. And in the way that our systems are structured, we are focusing on the one side, the healthy baby, the healthy mom. We're focusing on, all of that positive stuff. And we really leave out that dark side that really impacts a lot of people.
Mm-hmm. And one thing that's coming up for me too is like when we're able to invest in expanding prenatal care to include grief and loss, right? We're able to then really have positive impact, right? Because we're validating the person's grief, right? We're validating that grief and loss is something that could happen, right? And when we're providing services, one thing that's coming up for me is also like checking in with that person. Like, is there anyone in your life who's been impacted in this loss? Right? Making the mental health supports more of a systemic approach as well, a systems approach, whether someone has a friend that's impacted, right? Or a partner, right? Really kind of assessing for the person who else should be part of this care team as well.
Amazing. All of this, what's coming up for me, to use your words, is that a lot of this just reminds me that, and it's a lot of what comes up in the conversation about Roe v. Wade as well, is that women deserve wraparound care, whether they are able to have children or not, because the sole purpose of women is not just to produce infants. We are human beings who deserve care, whether we are able to have kids or not, and it should be a wraparound approach like CHCs offer, and that does include prenatal, pregnancy loss, all of these supports, because we are human beings with feelings who deserve to have mental health supports no matter what's going on in our lives, whether we choose to have children or not, whether we're able to or not, and whether something unfortunate like pregnancy loss happens. It's something I hear a lot in the conversation about Roe v. Wade, that it's not just about what this human being we potentially can provide to society. We are human beings, and we do deserve care now while we're here. So
Absolutely.
yeah.
And before we move forward, I just want to reaffirm as well what Renee mentioned, right? Is that the providers as well who are coming up with these programmings and trying to provide this support also need support, right? So however that look like, right? Because so many of this collaboration and inspiration come from the goodness of people's hearts too, right? And that's fantastic. Like that's fantastic, right? However, we cannot also ignore this intense rates of burnout, as Renee mentioned, right? So also checking in with providers, like what do you need to support the development of this program so you feel supported as a provider as well.
Course, absolutely. Super important point to end on. I want to thank you both so much for taking the time to speak with me today and for having held that concurrent session back earlier in the summer. Like I mentioned, I cannot speak highly enough about how enlightening it was and how moved I was. If anyone listening to this episode wanted to learn more about Women's Health and Women's Hands Community Health Center, the other programs, or the potential of having another program like this, where would they go?
Yeah, so we are on all of the socials on Twitter and Instagram. The handle is at WHIWHCHC. On Facebook, you can find us under Women's Health and Women's Hands. And we also have a website, which is WHIWH.com.
Awesome. Perfect. Thank you both so much for taking the time to speak with me today.
Thank you so much.
Yes, thanks for having us.
Bye. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.